You may be nearing retirement age, which means figuring out how Medicare fits into the full picture of your medical coverage. If you're feeling overwhelmed, it's good to start with the basics. Hi, I'm Tricia Sandiego. In my work with AARP, I help people understand the ins and outs of Medicare. Here are a couple questions I get a lot. What does Medicare Part A cover, and what are the costs? Let me break it down. Think of Part A covering common expenses related to a hospital stay. So that's things like your overall hospital care, your room, food, and nursing care. Part A also includes rehab. For example, physical therapy you might need after breaking a hip. And it covers some home health services like in-home nursing care and end-of-life hospice care. So that's what's covered. Now let's talk about the costs. The good news is that there are no premiums for Medicare Part A if you or your spouse paid Medicare taxes for at least 10 years. But there will still be out-of-pocket costs, mainly your deductible and coinsurance. You might be familiar with these terms from dealing with your private insurance, but they work differently in Medicare Part A. Here's what I mean. Part A deductibles are out-of-pocket costs you pay before Medicare starts covering expenses, which is pretty standard, but they don't follow a 12-month calendar and reset every year like a typical insurance policy does. Instead, you'll pay one deductible per benefit period, and you might have more than one benefit period a year. So that means you may have more than one deductible per year too. Okay, so you're probably asking, what is a benefit period? It's the period of time that begins the day you're admitted to the hospital and ends 60 days after you are discharged. Let me give you an example. You fall and you're admitted to the hospital. After you pay your deductible, Medicare will cover the remaining cost of the hospital stay if it's less than 60 days. If you are readmitted to the hospital within 60 days, you won't have to pay a new deductible. But if you're readmitted into the hospital after those 60 days, the clock starts over and you'll pay another deductible. Now, let's say you have to stay in the hospital for more than 60 days. You may need to pay a portion of that cost, which is called coinsurance. This is a percentage of the total cost of your stay. Yes, I know it seems complicated, so be sure to talk to your healthcare provider about the services they're offering and always check with Medicare to see what's covered and what's not. Since Medicare doesn't cover everything, when it comes to out-of-pocket expenses, you may want to consider buying a supplemental insurance plan. There's more on that in the description below. And depending on your income, you may be eligible for a Medicare savings program if you need financial assistance. I hope this video helps you understand your Medicare Part A coverage and gives you the knowledge you need to make an informed decision. For more details on this and many other aspects of Medicare, visit aarp.org/Medicare. Please take a moment to subscribe to our YouTube channel so you don't miss out on future videos like this from AARP.